Hi everyone, my name is Eduardo Reyes and I'm going to be talking about vaccinations. So have you ever or did you know? Have you ever wondered why it's so highly encouraged to become vaccinated, especially as a child? Or have you ever gotten sucked into a political debate regarding vaccinations and how harmful they can be for everyone? Growing up, I never really gave it much thought until I became a nurse. The benefit truly does outweigh the risks when it comes to getting vaccinated for multiple communicable diseases and infections. Vaccinations have always been a topic of controversy that many are not educated on and are driven strictly by political and religious views. It is extremely important to continue to educate the community regarding vaccinations and the benefits that provide to those who accept these vaccines. While concerns about individual safety and freedom are valid, the public health benefits of widespread vaccination, including the protection of vulnerable populations and the prevention of disease outbreaks, outweigh the risks, making vaccinations a vital public health priority. As someone who works in healthcare and carries a nursing license along with being a certified infection prevention nurse, I'm confident in the research that I've done throughout my years as a nurse. I'm also confident that vaccines are safe and continue to be a vital tool in preventing the spread of infectious communicable diseases. My experience, background, and continued engagement with current medical statistics continue to provide me with the knowledge to be able to speak confidently about this topic. I will discuss the importance of getting vaccinated and the reason why some may decline it. Then I will discuss the risk versus benefits regarding accepting and declining vaccinations. And lastly, I'll discuss the high-risk populations that is at risk for infectious disease exposure. The importance of vaccinations. Why are vaccines so important? Some may think that vaccines are harmful. Some may think that vaccines are against their religion. There are many reasons why vaccinations are extremely beneficial. Different vaccines work in different ways, but every vaccine helps the body's immune system learn how to fight germs and diseases. As stated on cdc.gov, vaccines help teach the immune system learn how to defend against germs. Vaccines can prevent common diseases that used to seriously harm or even kill infants, children, and adults. Without vaccines, your child is at risk of becoming seriously ill or even dying from childhood diseases such as measles and whooping cough. Many people are hesitant or reluctant about getting vaccine for multiple reasons. Cleveland Clinic Journal of Medicine states vaccine-specific concerns such as perceived side effects, safety, or efficiency can contribute to hesitancy, particularly if these concerns are fueled by sensationalized media reports or anecdotal evidence. Educating healthcare workers about the reasons behind vaccine hesitancy in the community and providing them with multiple strategies can lead to significant advances when discussing vaccinations with the public. Risk versus benefits regarding vaccinations. All medications and vaccines have potential risks that must be carefully outweighed against the benefits they offer to prevent illnesses. Vaccinations is one of the most successful public health interventions in reducing disease spread, preventing complications, and even deaths from vaccine preventable diseases. Vaccinations help our immune systems recognize and fight off contagious diseases. Without immunizations, you and your child are at a higher risk of becoming seriously ill or even dying from a vaccine preventable disease. The risk of vaccine causing serious harm or death is very small. Per Mayo Clinic, the benefits of getting a vaccine are much greater than the possible side effects for almost all children. The high-risk population of communicable infections. California has a large population of people experiencing homelessness that is characterized by a high proportion of people who are unsheltered, chronically homeless. These individuals are at a higher risk for contracting some form of disease or illness due to the lack of resources and readily available healthcare service. These individuals may suffer from already pre-existing conditions, putting them at a higher risk due to a compromised immune system, no means of paying for healthcare service, or no insurance and/or lack of resources while being on the streets. Per Global Health, people experiencing homelessness are at a higher risk for vaccine preventable illnesses. Factors impacting this discrepancy include difficulty accessing vaccines, health programs, lack of access to primary care services, and distrust of healthcare systems. In conclusion, as stated, there are many reasons why many individuals may decline vaccinations, but the benefit in vaccines truly do outweigh the risks in leading a healthy lifestyle. While concerns about individual and freedom are valid, the public health benefit of widespread vaccinations, including the protection of vulnerable populations and the prevention of disease outbreaks, outweigh the risks, making vaccination a public health priority. Vaccinations continue to be the leading beneficial factor in reducing the risk of infectious disease and germ exposure. Early vaccination not only is a benefit to yourself, but to everyone around you as well. Well, there you have it, everybody. Here is a little slide about vaccinations. Don't forget to get vaccinated.